Good morning, I'm Bridget Labelle, Health Director for LNIB. We just wanted to give some information and update around the coronavirus. We are working on the plan, taking it very seriously. We have our nurses here, Acoby and Irene, Howe.
So do we have any coronavirus in the community now?
No,
Bridget?
there is no cases in the valley at this time.
However, we want to keep it that way, right?
Yes.
And keep the spread, so this is why we're providing the information. So Irene, what is COVID-19?
Well, COVID-19 coronaviruses are a large family of viruses found mostly in animals. In humans, they can cause diseases ranging from the common cold to more severe respiratory illness such as pneumonia. Anyone that is concerned that they may have been exposed to the coronavirus or experiencing symptoms of the novel coronavirus, now known as the COVID-19, should contact their primary care provider. They suggest you not go directly to the hospitals, but use the resource 811. There's a helpline there. You can ask questions and they will give you direction on where to go and what to do. You also could access the virtual doctor website and speak to a doctor directly.
What are the symptoms?
Symptoms could range from a cough, fever is quite common,
Difficulty breathing.
It affects the most vulnerable, of course, those being the elders and children are at high risk. Especially with elders, it's reported that if you're over 80 years old, you're extreme high risk because a lot of elders do have lowered immune systems as we age, and also the fact that many elders have other underlying health conditions such as diabetes or COPD, things like that. So they are at extreme risk.
And Rainbow, how is the virus passed between people?
The virus is spread through droplets in the air, so from sneezing, from touching surfaces that have been sneezed on. A person can touch that and touch their face. They could get the virus that way. Some people also believe that the virus may be spread through stool, so it's important to always wash your hands. And for this virus, it seems to be very contagious. So I think the likelihood of it being spread through air droplets, so just by talking, there's droplets coming out of my mouth. These droplets can stay in the air for at least 2 hours. So sometimes you don't know if somebody's sneezed in a room and you walk in, you could be getting that virus even though you don't touch anything. So that is why we want people to stay away from public places as much as you can.
And so if I have a scratchy throat and just a dry cough, but I don't have a fever and I feel pretty good, what should I do?
You should stay home. You should stay home. Yeah. Anybody all adults, all children need to stay home if they are feeling unwell at this point in time.
And how long do they have to stay home for?
They need to stay home until you feel better, until you know for sure that you're not getting a fever, like at least 5 days. I would recommend if you're experiencing a fever, like 5 days after you realize you have a fever, you do need to stay home for sure.
And when do I need to call a health professional?
As soon as you develop a fever, you need to call 811.
When you have a fever?
Yes.
So I wash my hands. I watch kids wash their hands. They just kind of dip their hands under the running water, and is that good enough?
No. So in order to be really thoroughly clean, you need to use warm water, soap, wash for at least 20 seconds, rinse with more warm water. And you need to use a hand towel or paper towel is best. Paper towel also takes off at least 30 to 40% of germs when you're drying. And then you use a towel to turn off the taps.
And what about this hand sanitizer that everybody's got that you just squirt into your palms?
Hand sanitizer doesn't work 100% of the time. You can still have virus left on your hands even though you use the hand sanitizer. It is always best to wash your hands.
And I wanted to comment on hand washing as well. When they talk about hand washing, make sure you get under the fingernails and go like this under the fingernails because that's where the germs are going to gather. And also if you have any jewelry or Fitbit or anything like that, to remove it when you're washing your hands.
Why?
Because if there's anything under here, right, it's going, and also it's going to stay moist if you wash your hands and you haven't dried properly under your rings or whatever, it's going to stay moist under there and be a reservoir for the virus.
And moistness allows the germs to breed
Yes.
and travel.
Yes.
Good, poisoned by my own wedding ring.
Yes, and also to mention that the virus can't be treated with anything. You cannot use antibiotics to kill the virus. There is a medication called Tamiflu that people can use. They must use it within the first 48 hours of symptoms, otherwise it doesn't work. And this is probably only going to be used for people that already have health, like chronic health conditions.
Okay. Bridget, what is the band doing, like with the school or plans for that?
They're just going into spring break next week, so Rainbow is going into the school to work with the kids on how to wash your hands properly and show them the bug machine because it shows them how well they're actually washing their hands, and just trying to make sure that everybody in the offices at the schools are making sure that people are going home when they should be, and
Staying home when they should be?
home when they should be is most important. Any signs or symptoms that fall under that category, we need to enforce any of our activities, programs, that if you feel any symptoms, you stay home.
So my kids got the sniffles. Can we still go to the after-school program?
No,
And what will happen if they turn up with the sniffles?
they'll be driven home. And we are going to send a notice to all the parents stating this, like, if your child is going to participate, if we feel your child is sick and they're attended the program, they will be brought home.
What about travel?
Right now, I don't want anybody in community to travel anywhere outside of Merritt. It's pretty, there's no flying. I wouldn't recommend anybody fly anywhere unless it is essential. Airports, right now, people have been getting sick just by going to an airport.
Can I go to Kamloops to go shopping or Kelowna?
I think right now you can. There hasn't been any cases in Kelowna or Kamloops, but I would only say it's only a matter of weeks before there's an outbreak in Kelowna or Kamloops.
Back to the hand washing. How often do I need to wash my hands?
As often, if you touch your face or anything, like avoid touching your face, or if you're touching after eating for sure, but after touching your face or whatever.
Before eating for sure.
Yeah, before and after eating for sure. Anytime you sneeze or cough, wash your hands. If you think that if you touched it and it's unsanitary, because it could actually live on surfaces. We don't know how long. up to 2 hours minimum. They say up to 48 hours. So.
And what do you clean the surfaces with? Like, how do I keep my house clean?
You can dilute it with a bleach disinfectant. That's on the website, the CDC website that anyone can access, and it talks about housekeeping tips and what you should be washing your countertops and stuff with. Lysol wipes as well. But the best information is found on that website.
And we'll have the links on the LNIB website.
Right, and that website is updated daily, and it's always changing. So how do I keep my family safe? The tidbits we did talk about: stay at home when you're sick, wash your hands regularly, 20 to 30 minutes minimum, or seconds, 20 to 30 minutes. Avoid touching your face, cover your mouth and nose when coughing and sneezing.
So what do I do? How do I cough? How do
You
I
cough into your elbow, okay? Don't cough outright. And then when you, instead of handshaking, elbow tap or just wave, avoid touching other people.
No hugs?
No hugs, unfortunately. Avoid large gatherings, and also wash down high traffic areas, doorknobs, countertops, telephones, keyboards, things like that. Should be washed on a regular basis. Daily, if 2 or 3 times a day.
So I'm thinking about these tips, that they're probably good tips all year round during flu and cold season. And this will be good practice for everybody to get into the habit. Why is everybody running out and buying toilet paper?
The reason is that toilet paper, a lot of manufacturers, toilet paper is manufactured in China. So they feel it's not because of the symptoms of the virus, like diarrhea, I guess is one of the symptoms, but it's not just because the symptoms of the Covid-19, is the fact that China has shut down and there might be short supply of buying toilet paper. That's what I heard.
So it's crazy. You don't need a 2-year supply of toilet paper, I think.
Yeah.
What about wearing masks? Should I wear a mask just to keep myself safe?
Well, wearing a mask, the ones that you get with the ear loop, it is not properly fitted to your face in order to protect you from the virus. So wearing a mask is not very effective if you're trying to protect yourself from the virus. It is only given to people who are ill in case they might sneeze or cough or talking and releasing air droplets. It reduces the amount that's being spread into the air. That is only nurses and doctors right now are being fitted for special masks called N95, and those have to be specifically fitted for your face. So even if the public got a hold of an N95 mask, it might not fit them properly enough to protect them from the virus.
Okay. Last words, do we need to panic?
I think we need to be very worried and concerned, and we need to really take heed to following these precautions and take them seriously.
And think of your loved ones.
And think of our loved ones, yes.
Thanks, ladies. We'll do follow-ups as we need them.